Hello, I'm Rachel McKenty, Director of Programs and Development at Legacy Education. Thank you for joining me for the CPB Practice Exam Review covering Introduction to Healthcare. In this presentation, we will briefly discuss HIPAA and their covered entities and CMS Fraud, Waste, and Abuse. Question 1. What does the abbreviation HIPAA stand for, also known as HIPAA? A. Health Insurance Portability and Accountability Act. B. Health Insurance Plans and Accountability Act. C. Health Initiative Plans and Accessibility Act. Or D. Health Insurance Portability and Accountability Action. HIPAA stands for Health Insurance Portability and Accountability Act. This is a U.S. federal law enacted in 1996 to ensure the privacy and security of individuals' medical information. It establishes standards for protecting sensitive health data, including electronic health records, by setting requirements for how healthcare providers, insurers, and other entities handle and share this information. HIPAA mandates safeguards to prevent unauthorized access and breaches, and it grants individuals rights over their personal health information, such as the ability to access and correct their records. Compliance with HIPAA is enforced through penalties for violations, ensuring that patient confidentiality and data security are upheld in the healthcare system. The correct answer is A. Question 2. What are health plans, clearinghouses, and any entity transmitting health information considered to be by the privacy rule? A. Health entity. B. Business entity. C. Covered entity. Or D. Protected entity. The privacy rule is a key component of HIPAA. It establishes how covered entities must handle, use, and disclose protected health information, also known as PHI. Covered entities include healthcare providers who transmit health information electronically, health plans, and healthcare clearinghouses. Under the privacy rule, these entities must implement safeguards to ensure the confidentiality, integrity, and availability of PHI. They are required to obtain patient consent before using or disclosing their information for purposes other than treatment, payment, or healthcare operations, and they must provide individuals with a notice of privacy practices explaining their rights and how their information will be used. The rule also grants individuals the right to access and request amendments to their health record and to obtain an accounting of disclosures made of their PHI. Compliance with the privacy rule helps to protect patients' privacy and maintain trust in the healthcare system. Only covered entities are bound by HIPAA privacy rules. For example, it is not a HIPAA violation if a news reporter asks a congressperson their vaccine status. However, if the same news reporter asks the congressperson's doctor and they answer the question without consent, that would be a HIPAA violation. Question 3. Which of the following situation allows the release of PHI without authorization from the patient? A. Request for life insurance. B. Workers' compensation. C. Physician's office to release to family members. D. Request from family member. The privacy rule under HIPAA generally does not apply to workers' compensation claims because these claims are often regulated by state-specific laws and programs rather than by federal healthcare privacy regulations. Workers' compensation systems are designed to address workplace injuries and illnesses, and they involve a separate set of regulations and processes distinct from the healthcare system covered by HIPAA. In the context of workers' compensation, medical information is typically shared between employers, insurance companies, and healthcare providers to process claims and manage benefits. These processes are governed by state workers' compensation laws, which have their own privacy and data handling standards. While some states have privacy laws that protect the confidentiality of workers' compensation information, these laws are separate from the HIPAA privacy rule. Therefore, the specific protections and requirements of HIPAA do not extend to the information managed under workers' compensation programs. Workers' compensation is listed as one of the exceptions permitted by the privacy rule for use and disclosure of information. Other exemptions include public health activities, health oversight activities, judicial and administrative proceedings, law enforcement purposes, decedents, organ and tissue donation, and research. Question 4. Billing for a lower level of care than is supported in documentation, making false statements to obtain undeserved benefits or payment from a federal healthcare program, or billing for services that are not performed is defined as what by CMS? According to the Center for Medicare and Medicaid Services, also known as CMS, fraud, waste, and abuse refer to different types of improper practices that undermine the integrity of the healthcare programs, such as Medicare and Medicaid. Fraud involves intentional deception or misrepresentation made by a person or entity with the knowledge that the deception could result in an unauthorized benefit. Examples include falsifying information on claims, billing for services not provided, or falsifying patient diagnoses to receive a higher reimbursement. Waste refers to the overuse, underuse, or misuse of resources in a way that results in unnecessary costs to the healthcare system. While waste may not involve deliberate intent to deceive, it represents inefficiencies that lead to unnecessary spending, such as overutilization of medical services or supplies. Abuse encompasses practices that, while not necessarily fraudulent, are inconsistent with accepted sound medical, business, or fiscal practices and result in unnecessary costs or improper payment. Examples include mischarging patients for services or equipment, or improper billing practices that do not align with established standards. CMS emphasizes the importance of preventing, detecting, and addressing these issues to ensure the integrity of healthcare programs and to protect taxpayer funds and patient care. Knowing these definitions, when we revisit the question, all of these actions are considered fraud by CMS. CMS defines fraud as making false statements or misrepresenting facts to obtain an undeserved benefit or payment from a federal healthcare program. CMS defines abuse as an action that results in unnecessary costs to the federal healthcare program, either directly or indirectly. Question 5. A claim is submitted for a patient on Medicare with a higher fee than a patient on insurance ABC. What is this considered by CMS? A, fraud, B, abuse, C, waste, or D, malpractice? As we previously reviewed, CMS considers abuse to be actions that cause unnecessary costs to a federal healthcare program, either directly or indirectly. CMS examples of abuse include misusing codes on a claim, charging excessively for a service or supply, billing for services that were not medically necessary, failure to maintain adequate medical or financial records, improper billing practices, and billing Medicare patients a higher fee schedule than non-Medicare patients. Thank you for joining us. For more CPB practice exam questions, please visit our website at medicalbillco.com.